Alzheimer's disease is a progressive neurological disorder that gradually destroys memory and cognitive skills, ultimately impairing the ability to carry out the simplest tasks. Individuals with Alzheimer's experience a decline in memory, language, problem solving, and other cognitive functions that affect their ability to perform everyday activities. As the disease advances, patients may undergo personality changes, become disoriented, and struggle with motor functions like walking. Currently, there is no cure for Alzheimer's, but treatments involve managing symptoms through medications and supportive therapies to enhance quality of life. Risk factors for developing Alzheimer's include age, genetics, lifestyle, and certain health conditions, such as cardiovascular disease. Here's a detailed look at the different aspects of Alzheimer's disease. Symptoms and progression of Alzheimer's disease. Alzheimer's disease, a progressive neurodegenerative condition, commences with mild memory lapses and difficulty recalling recent events or conversations. As the disease evolves, individuals may struggle with language, experiencing trouble with vocabulary, particularly in naming objects. Disorientation in time and space becomes prevalent. Sufferers might get lost in familiar settings or misinterpret dates. Progressive deterioration in cognitive functions leads to challenges in executing complex tasks, planning, organizing, and following instructions. Eventually, the ability to perform everyday activities is lost. Mood and behavior changes arise, including depression, apathy, social withdrawal, mood swings, distrust in others, and changes in sleeping habits. In late stages, severe symptoms necessitate full-time assistance as patients lose the ability to communicate, fail to recognize loved ones, and become bedridden, culminating in fatal complications such as infections. Diagnosis of Alzheimer's disease. The diagnosis of Alzheimer's disease has evolved significantly with advancements in medical imaging and biomarkers. Traditionally, diagnosis relied heavily on clinical assessments of cognitive function, but with the advent of PET scans and cerebrospinal fluid analysis, doctors can now identify amyloid beta plaques and tau protein tangles, the hallmark indicators of Alzheimer's, before significant symptoms manifest. Genetic testing for APOE4, a gene variant that increases the risk of Alzheimer's, also informs earlier intervention strategies. Despite these breakthroughs, challenges remain in distinguishing Alzheimer's from other forms of dementia in the early stages. Consequently, accurate diagnosis often necessitates a multifaceted approach, combining neuropsychological testing with cutting-edge diagnostic tools to tailor treatments and manage the disease progression more effectively. Cause and risk factor of Alzheimer's disease. Alzheimer's disease, a debilitating neurodegenerative disorder, has a multifactorial etiology involving both genetic and environmental factors. The primary risk factor is age, with the prevalence doubling every 5 years after age 65. Genetics also plays a crucial role, with variants of the APOE gene, especially APOE4, significantly elevating disease risk. Familial Alzheimer's, linked to mutations in the PCM1 and AP genes, underscores its hereditary component. Additionally, lifestyle factors such as cardiovascular health, diet, exercise, and cognitive engagement are acknowledged risk modifiers. Emerging evidence suggests that chronic inflammation and exposure to certain environmental toxins may also contribute to the disease's onset, painting a complex interplay of factors leading to Alzheimer's. Treatment and management of Alzheimer's disease. The treatment and management of Alzheimer's disease, AD, primarily revolves around symptom management, as there is no cure for the disease. Cholinesterase inhibitors, such as donepezil, rivastigmine, and galantamine, are often prescribed to improve cognitive function or delay the worsening of symptoms. In moderate to severe cases, memantine is used to regulate glutamate, which can help with memory retention. Recent therapies have also explored the use of monoclonal antibodies aimed at targeting amyloid beta plaques, one of the hallmarks of AD pathology. Additionally, non-pharmacological approaches like cognitive stimulation, exercise, and diet modifications are advocated to enhance quality of life and potentially slow disease progression. Caregiver support is equally integral to management, focusing on the education and emotional well-being of those looking after individuals with Alzheimer's.